Our patients typically come in order to get diagnosed with FND or make sure that they don't have epileptic seizures, they stay at our epilepsy monitoring unit, our EMU first. And so that's inpatient. Then they'll be referred for treatment of neurobehavioral therapy is what we call it. It uses I call it a mashup of different modalities of treatment to really taper the treatment to the patient and what they're presenting with. When they come to us, many of the times the patients will be, I haven't been diagnosed in years. And when it comes to psychiatric conditions, the quicker you have that diagnosis and clarity and treatment plan, the better outcomes. And so helping them to bridge the gap and learn what it is, work through the stigma that even if others discounted you, these are actually experienced symptoms you're having. Besides just information gathering, what I'm really looking for is how it's impacting their life currently and really areas they're hoping to improve in, such as one thing I hear often is I want to be able to drive again. So we identify that as a goal. Okay, this is your goal. This is how you kind of start working towards that. And then I explain the treatment, what it entails, and how I kind of adapt it to what they're looking for, what specific needs they have, and also how we're meeting the intention. So working with their change in functioning and letting go of the idea of how I used to be and focusing on how they are now and what places what categories or domains they can improve in to get them back to similar to where they were. But this is like a new them. So there's a bit of an identity shift that can happen too. So I get to know them, I get to know what they're interested in and help them reconnect to those things. And I really like that. I really like that they're having corrective experiences with a psychologist. I want them to feel empowered to connect to providers in the future. And this is kind of how I help my patients, it's a big part of it.